So I then really thought a lot about how I wanted to communicate with doctors because I did have a blood cancer disorder. I needed a stem cell transplant. And everything went very successfully. But post transplant, which was in 2019, I had a lot of health issues, meaning I had to see probably 10 different specialists.
We're increasingly living in a world where trust in our medical system, trust in our healthcare system is at the lowest point there is. Most people are not happy. They are not trusting their doctors. And one of the things they talk about is how when you go to a regular PCP, a doctor, you have 7 or 8 minutes. They don't really take the time to get to know you. Hi, Dana. Welcome to the show.
Thank you, Mark. So great to be here. Appreciate it.
Thank you for being here. Welcome to Peak Performance Perspective, where we help entrepreneurs master health, wealth, and relationships. I have to start out by asking, what does peak performance mean to you?
I have always thought that it's important to do all that you can to live the best life that you can. And from my sort of subject matter expertise, which is about being engaged in your healthcare, it's really about having the best health outcomes possible because you are engaged in your care. So that's the perspective, that's the peak performance perspective that I'm coming from, and particularly for the point of this conversation today.
You obviously have a long, illustrious career in healthcare management, but can you tell us a little bit about your personal journey as a patient and how that shaped your views on healthcare communication?
Sure. It's actually something that I've thought a lot about, not before I got sick, because we're living our lives. I had children. I had a very big career in healthcare administration. I worked at many different settings, and I really led a very productive and business life until I was diagnosed with a chronic illness. It was a blood disorder. And at first, I just needed to be monitored by doctors. And then when my health crashed, really my worlds collided. My professional world collided with my personal world of being a patient. And when things collide, two things can happen. Everything could be destroyed or something new could be created. And I decided that I was going to create something new because I wanted to live and I wanted to get through this health crisis that I was in. So I then really thought a lot about how I wanted to communicate with doctors because I did have a blood cancer disorder. I needed a stem cell transplant. And everything went very successfully. But post transplant, which was in 2019, I had a lot of health issues, meaning I had to see probably 10 different specialists because the transplant itself affected many parts of my body. So I had to be really diligent about how I went through my health journey because I was seeing so many doctors. And ultimately, you are in charge of your own health. 15 doctors aren't going to communicate with one another. You have to be the center of the information and communication for your health. And that's a big job to do. And it's also scary. And because I was a healthcare manager for many years, I knew the different important sort of skills and strategies that you needed to be really organized and on top of things and communicate. But when it comes to healthcare and being a patient, there are so many different aspects, and the stress of it all can really just bring you so down that having strategies and skills to be able to communicate with doctors and deal with health issues really give you a pathway to, yes, you have anxiety, you have stress, but gives you a pathway to move forward in a way that's really good for your health and important to come out on the other side and to the best of your abilities as well.
You created a framework called the 5 parts of communicating better with doctors. Can you briefly walk us through that model?
Sure, be happy to. So again, when I started feeling better, which was only about 2 years ago, I thought I've learned a lot in this process. How can I share that with other people and make it meaningful for other people to help them through their health journey? And then as I was going through it, and I'll share the framework in a minute, as I was going through it, I realized I should have been doing this when I was in my 20s, in my 30s, in my 40s before my health crashed. These are basic constructs because essentially we're all patients. We all need to see doctors at different points in our lives. And whether we see doctors once a month or once a year, having focus about your health, and aside from nutrition and water and exercise and all the things we all know to be very important to maintain a healthy life, to have a structure and a process for being able to communicate better with doctors is an important thing, no matter whether you're healthy or whether you have an illness that you need to deal with. So I started with preparation. So the first part of the framework is preparation, because when you go into a doctor's office, there are limited appointment times. You have to get the most of that out of that appointment. You have to be prepared as possible. And that includes, on a first meeting the doctor, knowing what the doctor needs to know about you in order to tell your story and to communicate the things so the doctor could have it in their mind. What are the pieces that may be relevant that I may want to follow up on, either a more description or previous lab tests or other things. So preparation is very important. And also again, to make best use of the 15 or 20 minutes you may get to see the doctor. And also, I have found that doctors respond very enthusiastically to people's interest when they come in prepared and have prepared questions and have something in their mind that they want to accomplish for that appointment. So the second part of the framework is language. And it's really knowing the language of your own health and or things that you want to do to have more of a wellness journey, but knowing that language. So if you have a diagnosis, you need to understand what the diagnosis is, and also to express what you're feeling, like really from a psychological point, from a physical point, from experiential, what are you experiencing, and having that language. And again, it's to the best of your ability. Certainly health literacy plays a part, but it's your own interest to really take the time to learn that language. And then the third part of the framework is questions. And I talked a little bit about it in the preparation phase. You put together the questions either based on your research or based on what you want to know. But questions really help you delineate from what you don't know. And that is really important. And it's okay to ask a question many different kinds of ways till you get an answer that you can understand what the doctor is explaining to you. Because in all my sort of presentations to communities, to other people, this is very often brought up as an issue that the doctor will explain things in a way that they don't understand. So they don't know, they don't want to insult the doctor, and they don't want to take up any more of the doctor's time, but it's the patient's right and responsibility for their own health and being to try to get the answer. And it's okay for a patient to say, I'm not really getting it. Is there a website resource I could go to? Do you have a pamphlet? Do you have a visual aid? That kind of thing, in order to get questions answered. So that's a very big part of the process too. The third part is participation. And participation means, and it basically focuses on the 15 or 20 minutes that you're in the office, participating with the doctor in a conversation, taking advantage of every opportunity to react and interact with the doctor, asking questions, following up, sharing, look, I'm feeling this, what do you think? Or what it is you're doing, or how are you performing that? Or what does this diagnostic test mean? So that you really are part of this process and you're really engaged, not just engaged before and after your visits and your health and following up and taking care of things, but engaged with the doc. And there obviously is a lot more to participation. But the fifth part also puts a connecting thread among the other four parts. And this part in and of itself, I call it courage. And the courage is, it's hard when you're sick. It's hard when you have a life-threatening illness. And I did. But it's also hard when you don't want to know what's wrong with you. And that's what I faced for the first 8 years, of little things being wrong with me and not really wanting to know what it is or take care of it. And so it's having this courage to say, I want to be as healthy as I can, and I shouldn't be afraid of the doctor. And I'm getting more and more knowledge. So the point being, two things can exist at the same time. You could be anxious and stressed and scared about your future. And you could also have these tools and knowledge and asking people for help to help build that courage a little bit at a time. Because the more you learn, the more courageous you will be. The more you ask a question, the doctor says, you know what, that's a good question. I'm glad you brought that up. I forgot to mention that to you. Because what I have found also is that if you don't ask a question, the doctor will think that you understand. So it's important to keep interacting so that doctor knows what you know and what you don't know. And that also helps build your courage to the point where you feel really good about participating in your own care and that you're doing everything that you can to improve your health. And I usually portray the 5 parts of communicating better with doctors like the pieces of a pie, because I really think all the parts are connected, not just a list of things that you need to do, but they're very specific actions that you can take to improve communication with doctors and take better care of your health.
You spoke about how if we are not vocal with the doctor about asking questions, the doctor believes that you understand everything as a patient. What are some other misconceptions patients have about their role in this healthcare process?
There are a number of them. I'll mention a few. The first is that a very large percentage of patients don't want to share certain sensitive issues with doctors, like how much they drink or smoke or do drugs or sexual lifestyle kinds of issues. And they don't want to share because they don't want, or even like trouble sleep, they don't want to share because they think it'll shed a bad light on them. The doctor will look at them in a different kind of way. And that's not what they're there at the doctor for. They would say, I didn't go to the doctor for that reason. However, these things, the more that a doctor knows about a person and their lifestyle and what's going on in their environment, the more the doctor can help in both direct and indirect ways. From this is going to help me with the diagnosis and the diagnosis process. This is going to help with the process of helping you find a better way to live a healthier way to live your life. So I would say, not sharing, withholding, or not sharing information with the doctor, I think is one major thing. The other thing is that patients tend to think, some patients think that doctors know, I'm just going to leave it to doctors. I don't want to be involved in this. I will leave it up to the doctor. The doctor will decide, let the doctor make all the decisions. Really, in the last 20 years, there's been a whole movement in the medical community to have more shared decision making. And it's very important. The doctor needs to have that interaction with the patient. And I think patients has been a big patient-centered movement as well, that it's important for patients to participate and agree. Because if the doctor is saying, I'm going to give you this drug, but it's going to make you very sleepy, I can't doctor my work. And that's just a very superficial example, but shared decision making is very important. And then the other thing is you can catch a doctor on an off day, meaning the doctor is extremely busy all day long, and they're looking at lab reports and diagnostic test analyses and all of that. And if you're a complicated patient, or even a patient just for 1 or 2 issues, doctors can miss something. I went through this. Doctors missed certain things, and it took months for me to say, I'm still not feeling well about this. What could we do? And then it's addressed. So you have to be always prepared. You can't just always rely on the doctor. Patients have responsibilities in this process as well.
I talked about how you had a long career in healthcare management prior to experiencing the other side of it as a patient. What was your biggest takeaway from shifting roles, from being a healthcare executive to now a patient?
And sometimes I call myself a professional patient now, but I have been feeling so much better, and I'm really out there in the world much more now. So that's all good. But I would say that as a patient, or in any new endeavor that you would be embarking on. So for me, that shift from really having a career in healthcare to then being a patient, it's what do I need to shift? What did I need to shift in my life? What did I need to shift in my mindset, in my day-to-day self-care management? These were all major things that I had to change the structure of my day-to-day life in order to take care of myself. I'm on 15 different medications, so medication management. And I was very fortunate that I had really the brain power and the physical ability to be able to mainly take care of it all myself. But it's about that mindset that my life needs to be different because it needs to focus more on me and what I need to do for my care management and what I need to do, some of the things that everyone needs to do every day, drink more water, exercise, able to have some of those tools in terms of strategy, in terms of research, in terms of communicating, in terms of asking questions. But I actually love to do research. on new topics. And I am very focused on taking care of my own health. And it also allows me to then share what I have learned with other people.
On the other side of things now, what do you think healthcare providers can do, given your experience on the administrative side? What do you think healthcare providers can do to improve that communication, to get effective communication with patients?
I do think about that a lot because I came from that side of it. But overall, I think there generally needs to be more patient education. I think the 5 parts of the framework that I described, that I think it would be helpful for doctors to share with patients, that they would be better served by preparing before appointments and keeping a notebook and writing things down and having certain methods for follow-up, for providers to share trusted resources for additional health information so the person can get to know what they're experiencing, and also for providers to share that there are patient peer communities that are out there. The internet makes this widely available. And I had an amazing patient community that I have relied on for over 20 years, the Myeloproliferative Disease Foundation, which just tons of resources for patients and for caregivers and for people not feeling so alone, whether they have a really popular disease or whether they have a really rare disease. So yeah, I do think providers can do a lot more. I guess I wouldn't have embarked on needing to put forth the methodology and talking about the patient's role in communicating with doctors if I felt that I saw that happening already. I wouldn't have put together my resources and my approach to having bolstering the knowledge and skills of people to be better patients, because I believe that we are all patients at one point in our lives than others.
There are challenges that come with managing care across multiple specialists from a patient perspective. How does your framework address this? And what tools do you have that can help somebody get through this easily?
Yes. All right. I believe that even though there are electronic health records and patient portal, if you go to different health systems, they could have different systems. There's 1 or 2 dominant systems out there, but I have the experience of being part of 2 major academic medical centers in New York, and they both use different systems. So each one cannot see the records across. So I'm the one who takes responsibility for bringing that information to the doctors that I see. But generally, I think just to leave it up to doctors to read through your records, I think you need to be up on your own records and have command of your records. And by doing that and by keeping track of the discussion that you've had with different specialist doctors, I think that, and you bring that information forward to the other specialists, I have found that very helpful. And when I really don't understand an answer I got from one specialist, I will then ask another specialist, because even I'm in the realm of the blood cancer that I had was an oncology disease. And so most of the specialists I see, like the cardiologist, is a specialist in oncology. The ophthalmologist is a specialist in oncology, and they understand. So there is that through language for them. So by being organized with the discussions you've had in previous appointments, you could bring that to the next doctor and the next doctor and the next doctor. And again, I would say ask each doctor what other resources they would recommend, what other resources some of their patients have found extremely helpful. And do they have brochures? It seems like so old-fashioned these days. However, there are a lot of people that really are not good at doing research on the internet, and particularly people who have not grown up with the internet, which is probably people maybe over 70 years old. I'm just guessing on this. But some of the feedback I've got from older people over 70, they have really a hard time because they have issues with their hand or their eyesight, and they don't really easily use patient portals or are easily able to download information. So when somebody brought that up at one of my sessions, I said to them, ask your doctor to ask the office staff, can you please print this out for me? And they will do that. But I think you just have to keep figuring out what resources you can use and what resources are available to you. And you have to be the one, because again, If you don't say anything or ask anything, the doctor's going to think, oh, they're okay with all of this.
From your perspective, having been actively involved on both sides of the system, are the perspectives of patients and doctors more aligned than people think? Or where do they tend to diverge the most?
Okay. Some of the biggest areas that patient and doctor's perspectives, and you would think, oh, it's totally on the opposite end. But I have really learned that not to be true. Clearly, there are limited appointment times, and patients feel a lot of pressure about limited appointment times. How do you think doctors feel? There's so much pressure. They have a patient that talks a little more slowly or that is more complex and they need more time. But the pressure of their practice makes it such where they really have to fit it in within that set time. So on that score, they're both the same, right? The patient is not always prepared to share all of the history or share their story or share what they're feeling. You meet someone for the first time, you're not going to just download your whole life to the doctor. But yet on the other side, the doctor needs this information to go forward. I think patients sometimes they want everything on the doc, say the doctor knows best. But yet the doctors really want to work with the patients. So there's a little bit of a disconnect, but I have experienced doctors who are very interested in communicating in a way that allows the patient to tell their story and ask the follow-up questions and really encourages and is compassionate to the patient to share their story and what they're feeling. So there's a lot more alignment than there is disalignment between doctors and patients.
With the future of healthcare communication evolving, especially with the rise of telemedicine and there's so many digital health platforms, what is your vision for the framework that you have created and the tools that you're developing?
That's a great question. I have a vision where the framework is available to as many people as possible and who are interested. And within the framework, there are tools. So I had described each part of the framework. And when I talk about it, I talk about what is it and why it's important. But the most important thing is how to do it. So for each part of the framework, I have how you can accomplish that. And I think that the more that people find that these tools are useful, when they're at a doctor and they're sitting with their notebook on their lap, taking notes and talking to the doctor and having prepared questions, it will reinforce in the doctor's mind. I have a patient who doesn't come so prepared. Maybe I can share what another patient does. I'm hoping that the framework and really the philosophy behind this, that a patient has a very big important role to play, and that the more a patient is engaged in their care, the better the health outcomes will be. And health science researchers have actually studied this issue and found that the more a person prepares in advance, the better their health care outcomes are. And when I was doing my research and I discovered this, I said, oh, this makes so much sense. And I'm so glad to hear this. I am one person. I'm not part of any institution. But as I go through the course of the process of me sharing my sort of newfound methodology and way of thinking about communicating better with doctors, I'm just hoping that I can help to inspire both on the patient side and on the provider side that there are ways that we can communicate with each other better.
You went through a very difficult situation in your life, scary situation upon your diagnosis. And you took it upon yourself to really take charge of your own health. But you are not just Dana Sherwin, the person who got diagnosed with scary condition. You are also a highly educated professional who perhaps has skills that she has developed to deal with the stress and then deal with the fear. But for those who aren't as skillful as they, for those who feel overwhelmed and intimidated by not just the healthcare system, but also the diagnosis they have, what are some of the steps you would tell them so that they can prepare themselves to become this more empowered, engaged patient? Because tools will only take you so far as we are willing to use them. How do we become that person first?
I think that's a wonderful question. Certainly, it's up to each individual person to find their why they want to have a better quality of life, healthy life. And when you have that why, and it's not just like living for other people, it's about living for yourself. And when you have that why, I want to live for me and to have a longer life, I think it's very motivating. What are the buildings, starting small? What are the small things that I can do? What's something that I can do every day to focus so I can learn more and I can participate more and I can question more and be an advocate for myself. So I think that, look, everybody is different. When you have a good support system, family, friends, that really helps. And asking for help really helps. But on top of it, for me, because I had what's considered a rare disease, I really turned to patient communities to see how other people did it. Just like, where are my role models? People who have been through this process successfully and people who now are at the other side and are living healthy, productive lives. So I think the classic things that we do when we really want to achieve something are the same methods that we use to want to go through a health journey, even though it could be extremely scary. And also, sometimes it just locks you up and it makes you either depressed or sad or frozen in your actions. Small steps and that whole mindset of, okay, what can I do a little bit more every day to be able to get there and also take care of myself.
Having gone through this entire process, I'm sure there have been moments where you uncovered some type of a secret, some type of a methodology of learning something, knowing something, some fact that you came across that made you feel like, no, this existed, or I didn't know that happened. Just for fun purposes, if you were to share that secret, what would that be?
Personally, it's don't give up, don't ever give up. Personally, it's the second is that when people that you trust, let's say healthcare professionals that you trust, tell you something, you need to listen very carefully. And I'll give you one example. When I was preparing for a stem cell transplant, and it was about a 3-month preparation of all the things I needed to do, and I had to see doctors beforehand and get medically cleared and everything. One of my doctors said to me, I just want to tell you, Dana, that you cannot go into this process for the 5 weeks that you're in the hospital, thinking that you are going to be able to control everything. There's a process that happens, and that people who were CEOs or directors don't do that during this process. So I thought about it. And the first day I was in my room that I was going to be in for 5 weeks, I was so busy thinking about all these things I needed to do and set up and accomplish that his words started reverberating in my head. A very experienced who said, let go and let the process happen. And I did. And it was some of the best advice I've ever been given. And I've not shared that story with anybody. So thank you for asking.
We're increasingly living in a world where trust in our medical system, trust in our healthcare system is at the lowest point there is. Most people are not happy. They are not trusting their doctors. There's a lot of holistic alternative medicine practices that are out there. And one of the things they talk about is how when you go to a regular PCP, a doctor, you have 7 or 8 minutes. They don't really take the time to get to know you. Having gone through this end to end, not just with a cold or a cough, but a life threatening disease, what is your message to those who are truly the healthcare system and the care they're receiving? Not because they're just skeptics, but because they're scared and they want to do what's best for them.
I think a big part of it is finding doctors that are right for you. And when you can have honest conversations with doctors and you sense and feel that they are responding to you and communicating with you and care about you, that's a really important thing. Even if you're interested in alternative health kinds of treatments, to talk to your doctor about that. I think it's very important. You can find somebody who you really trust is going to listen to you and be concerned about it. And if you don't, and if you can't find, if that doctor is not that person, then you should find another doctor. And I say that all the time to people. If you sense that doctor is not responding to you or is being really short with you, you need to find another doctor. It's not so easy in certain places because there's not like a plethora of certain kinds of specialists. However, for a primary care doctor or a super specialist like hematology oncology, you need to really be comfortable and trust that doctor. And it's okay for people to trust their gut. You have to know yourself and say, what are the reasons that I'm feeling this way? And perhaps you talk to your doctor about, look, I didn't like what you said to me the other day, or I didn't feel like you explained this right. Just say it in a respectful way. Doctors need to be respectful. Patients need to be respectful. And it's okay to say, can we revisit this question? I want to share who I am. I have a need to know. I want to take care of myself. I want to be able to work with you in the most effective way possible.
In a world where everybody is so worried about prolonging their lifespan, not many are wondering about how to improve the quality of that prolonged lifespan. And your work is doing both of that. Your work is giving patients the tools to be able to communicate with their care provider so that they can prolong that lifespan, but also improve the quality and the journey throughout it. Furthermore, I think what makes you different is that at the end of the day, you are giving people a voice. And we only are able to vocalize how we feel when we know our rights. And we know our rights by understanding the nature of the relationship we are in with anybody, in this case, patient and doctor. The work that you're doing, Dana, is profound. You didn't have to do this. You have an illustrious career in healthcare management. You work with one of the New York's topmost practicing research hospitals. You got healed. You got to thank God, thank the universe, been happy, and move along. But the fact that you didn't, and the fact that you thought about it and obsessed about it and created a tool and created a framework, and now going out there spreading that message speaks volumes about person that is Dana, not just the specialist and the professional Dana is. And it's amazing to meet people like yourself who go through an experience and then make their life's mission to ensure that others don't. Suffering teaches us lessons that books just don't. And as someone who has suffered personally, this is personal to you, and I can feel that. It's an honor and a pleasure to be able to have you on my show and discuss these things. Any last words that you want to share with our audience members?
I want to thank you for that comment. It means a lot to me because I do think about these issues a lot, and I do try to I try to turn every experience I have with my continuing health journey into something that I can share with others. I share all my new content on LinkedIn, and I write about different things that I think are important for people to know about communicating with doctors. And I've been getting a lot of good feedback on this is really interesting to know. I didn't normally know that. I also want to try to make it less scary for people by saying, oh, maybe you've thought about this, but it's okay to have your own judgment about when you meet with a doctor and assessing that doctor's ability to work with you and you to work with that doctor. I will continue on, and it really gives me my why for turning this sort of health crisis into an opportunity for me to connect with people and help people and hopefully bring more health to the world. So thank you, Mark, and I really appreciate your wonderful
Thank you
words.
for being on the show. I hope to talk to you soon.